Obesity is a public health challenge. It's affecting people in many parts of the world. And the bigger problem is it can lead to so many chronic diseases. But it's never too late to take action. In today's program, we'll look at the causes, the factors that contribute to obesity, and the ways in which we can manage. I'm Dr. Freddy Gomez. You're watching Med Talk Health Talk. We often hear people say they want to live a healthier lifestyle. Others who have weight problems try to lose weight on and off, but fail. We know it's not easy. And there are many reasons why people can't control their weight. But now more than ever, especially because of COVID-19, it's a good time to start living a healthier lifestyle. Overeating remains a prominent cause of weight gain, but it's not the only reason. We'll know more from our guests. I'd like to welcome on the show Dr. Shokswan Kua. She's a pediatric endocrinologist and the past president of the Philippine Association for the Study of Overweight and Obesity. We also have Dr. Christian Flores. He's the director for the Center of Preventive Health and Lifestyle Medicine at the Medical City. Welcome to the show, doctors.
Hi.
Thank you for having us here. Good day.
Good to have both of you on the show. Now, when you consume more calories than you can burn, you can gain weight. But there are other factors that contribute to this. Can you tell us more about this, Dr. Kua?
Okay. It's true that if you consume more, you take in more calories, we would gain weight. Especially if we are not moving, we are so sedentary, sitting whole day. There's some genetic factors, we cannot change it, but there are environmental factors which we can modify. And this is what we have to teach people, how to have a healthy lifestyle.
Kaya napaka-importante na sa simula pa lang, you know how to control your weight to avoid comorbid conditions. Let's look at some of these medical conditions. In fact, what I really want to say is it takes more than willpower to lose weight. Because for some people, there are other medical reasons that can lead to weight gain. Factor pa rin ba dito ang overeating?
There are certain conditions like if you have some issues with mental health, and if you're taking certain medications, some of these medications can actually increase appetite and can cause you to, beyond your will and control, cause you to eat more. And this can actually contribute to the issues of the weight gain. So there are also certain medical conditions like a problem with the thyroid that can actually lower your baseline metabolism. Not necessarily causing you to eat more, but actually you eat the same way that you do, but you're actually gaining weight. So these are the conditions that really need to be screened beforehand, before undergoing any weight management program.
Ganun din ba sa case ng mga bata who are already obese or overweight?
I think we have to tackle it's the misperception of the parents about weight. Many of us think overweight, mataba ay malusog, or overweight, chubby, cute. And so many parents keep on feeding the children excessively convenient food. So, and then also the parents nowadays are so afraid that their children might fall, so they don't want the children to move a lot, to go out because of the security reason. So excessive caloric intake and sedentary lifestyle also contribute. There is a small percentage, we call it genetic causes of obesity, but that is a small percentage. There is a polygenic or monogenic causes of obesity. Like we do have some syndrome, Prader-Willi syndrome, but that is a small percentage. Majority is due to the environmental epigenetic influence. So not eating right. We have too much high caloric fast food, too much sugary drinks.
That's right. So kailangan rin talaga ng tamang diagnosis. So please, especially with your children, don't just put them on a diet if you think they're overweight. Our best advice, please seek a medical professional. We'll tell you more about that later on. You're watching Med Talk Health Talk on CNN Philippines. The World Health Organization has been sounding off the alarm about obesity, calling it an epidemic. But it's preventable. Still with us are pediatric endocrinologist Dr. Shokswan Kua and wellness expert Dr. Christian Flores. Explain muna natin what's the difference between obesity and being overweight. Dr. Kua?
Yes, overweight means the weight of the children is a little bit about the healthy weight. No? And obesity, we have much adiposity. We have reference like WHO. We can there's a WHO growth charts, BMI charts, and it by WHO definition, if you're overweight, let's say 5 years and above, that means your body mass index is more than one standard deviation. If it's more than two standard deviation, we call it obesity. Generally, for layperson, I also advise that we look at the abdominal fat. If the waistline is big, it is higher risk. So we do body mass index to assess children. This is age-related, sex-related. We do have the chart for boys and girls. There are also, let's say, in the United States, the CDC, they would use, if a person's, they use the percentile. If it's more than 85th percentile, it's overweight. More than 95th, it's obese. So there are some references, and these are all available in the website. And for the pediatricians, we usually plot the weight and height on the growth chart. And we correlate the weight in relation to the height.
Okay, now Dr. Ian, can you tell us what doctors will want to know or look into before they recommend a plan for someone who is overweight or obese?
Well, there's no set or decahon way of prescribing a diet. Really, it has to be individualized and personalized. No? You might, there are so many kinds of diets that we can recommend, but basically the basic tenet really is to adhere to a lower calorie diet. Okay, so that over time, as you consume every day this relatively low calorie diet, then eventually you reach a certain weight goal, a reduced weight goal.
Okay, so that's good to know. So all those stats and specifics when it comes to being overweight or obese. Now, a 2019 WHO report says that an estimated 38.2 million children under the age of 5 years were overweight or obese. Obesity was once considered a problem in high-income countries, but now cases are on the rise in low and middle-income countries, including here in the Philippines. Dr. Kua, how do we prevent or manage obesity? Dapat ba ay may conscious effort na rin ang mga magulang para makaiwas ang mga anak nila rito?
Yes, it's true that even in the country like in the Philippines, we are seeing overweight and obesity on the rise. So we are seeing more in our clinic. So we have to, as pediatricians or healthcare worker, we have to place emphasis on growth. It's not just the weight, but it's weight in relation to height. And we usually have to plot the height and weight on the growth chart. And if it's older, we compute the body mass index like in the adult. So we show the parents, sometimes the parents will come and say, ay, doc, hindi tumataba yung aking anak. But when you're looking at the child is already on the overweight side. because their reference is they see the neighbors, yung mga sobrang taba. Oh? So we have to explain and educate the parents. Oh? Because toddler from 2 years to 5 years, usually they are very active. They don't gain much weight, about 2 to 3 kilo in a year. Unlike during infancy, it is they gain weight. 6 months onward, at least half-pound half kilo per month. Oh? So we educate the parents, and we also ask what the child is eating. So they should not just keep on drinking milk or sugary containing drinks. So we teach them how to eat right. I think it's very good, the Pinggan Pinoy, teaching our people to eat right. But I noticed in my experience, our Filipino diet is very sweet, very salty, and quite oily. And nowadays, the parents give their children a lot of high caloric food, trans fat, so a lot of fast food. So we have to teach them. Just recently, I also have a patient still taking milk from the bottle at age 8 years old. So we have to teach the parents how to teach the children to eat right. No? We should not depend on just the bottle feeding. They have to eat the real food, but we can introduce it slowly, the healthy food, a little vegetable, a little fruit, so they get used to it. So not just taking milk and not just taking the commercial fruit drinks.
To the parents out there, as we said earlier, don't put your kids on a diet without consulting a healthcare provider first. Your children need to understand why they need to lose weight, that it's for health reasons and nothing else. At the end of the day, we want them to develop good eating habits. Everything in moderation is key. Now, what are some tips from you in terms of food preparation? Let's start with you first, Dr. Ian.
Yeah. Well, in terms of food preparation, we can use traditionally in the medical field, we do calorie counting, but not everyone can do calorie counting, especially the lay people. So we have two practical ways of recommending how to approximate or measure food is using either the hand method, using your palm, your fingers, or using the plate method. So the plate method, actually, we recommend that you portion the plate, like half of the plate you can put in your healthy grains, and that would include rice. But there are other healthy grains out there. 1/4 of the plate, you will portion your protein. It can be animal-based or plant-based protein. And a portion of 1/4 would be your healthy fats. Okay, this can be nuts, seeds, avocado, for example, fatty fish. So that's using the plate method. Using the hand method, actually, you can also portion your plate using the hand method. Like, for example, using this palm would be your a portion of your grains, 2 pounds, a portion of your vegetables and fruits. A thumb would be for fat. And maybe siguro you can use matchbox or matchbox size for your protein. So those are two practical ways of portioning your meals at home or even outside without needing to use calorie counting.
Okay, very good and practical ways in order to keep track of the amount of food we eat. And ahead on the program, the impact and health complications of obesity on your body. We'll find out more after the break. You're watching Med Talk Health Talk on CNN Philippines. There's a direct relationship between your diet, your physical activity, and your overall health. Your nutrition is a key player when it comes to physical, mental, and social well-being. And these are all factors that can prevent disease. Welcome to Med Talk Health Talk. Obesity or overweight increases the risk of developing a number of diseases. Let's discuss the most common medical conditions. Dr. Kua, could you give us some examples of these?
Okay, in children, I noticed obesity. It's associated with non-alcoholic fatty liver. They are at risk to have early onset of type 2 diabetes, and many of them can also develop high blood pressure, and even with dyslipidemia, that means abnormal cholesterol, triglyceride, in as young as 5-year-old. I do have patients like that, but the good thing is it's still reversible. So, and sometimes it's also emotional, and they might be being bullied. One time, one of my patients would say, she felt quite depressed because her classmate would call her baboy. So it's not a very good one. No? So we really have to support the child. So good health means healthy weight, but we also pay not only to the physical, but also emotional, mental health.
That's right. And losing 5 to 10% of your weight can actually delay or prevent some of these diseases. So if you're 200 pounds, it would be advisable to lose 10, maybe 20 pounds. So there are also some psychological effects to this. Can you mention some of these, Dr. Flores, and how can we manage to achieve a healthier mind?
Well, part of the biological and mechanical effects of being overweight and obese, you also have psychological effects. Actually, this may explain why some of us or most of people are stress eaters. They tend to overeat when they're stressed out. No? So anxiety, depression can either be the cause of and also the result of being overweight and or obese. So basically, obesity is not just a medical issue, but also there's a psychosocial component to this. And this can actually affect management. For example, if there's no family or a social community support to our patients who are obese, then more likely, even if you place them in a very good weight management program, it's bound to fail. It's because during your, for example, if I'm talking to my patient right now, there's this commitment and engagement to lose the weight. But when they go home and if there's no social support from the family or from the work environment, then there's a tendency for the program to actually fail. So point here is that everyone, the family, the friends, the workmates of these patients need to be all in the management of obesity in a particular individual.
Okay. Dr. Ian, I'd like to touch a little bit about the surgical side of weight management. At what point would you suggest some surgical intervention to manage weight?
Basically, you place, initially in a weight management program, you place the patient in a conservative management type, meaning you try first lifestyle intervention and you give it a timeline, roughly around 3 to 6 months. If it doesn't work with purely lifestyle intervention, that actually means diet, exercise, stress management, psychosocial support, then we move on to the next level by initiating or starting certain medications. Despite, even after that stage, hindi pa rin ho mag-improve yung pasyente in terms of achieving a certain weight goal and managing certain medical conditions, then that's probably the time, at least for me, to recommend for surgery.
Okay, so point being there is surgery is definitely should not be your first option. It is the last resort after a lifestyle modification. So that's what is important. So take action now. Please consult your doctor and get the medical care that you need. We'd like to thank Dr. Shokswan Kua, a pediatric endocrinologist, and wellness expert Dr. Christian Flores for sharing their time and expertise today. I'm Dr. Freddy Gomez. We'll see you again next time right here on MedTalk Health Talk.